So, Dr. Bedkar, should I start? Okay, sure. Okay, okay, ji, thank you.
Hello, am I audible, ma'am?
Thank you very much, Dr. Bedkar, for this wonderful initiative. First of all, congratulations to you and to the whole team. And thanks for the opportunity so that we can bring this awareness from my side, from my company, CtrlAltHeal side. We are actually trying to bring the lifestyle disease management through our all around the environmental resources, which is diet, lifestyle, sleep management, and stress management. And these are the issues, as we know, that which are arising day by day. So, not taking much time, I would just continue with the session. I would like to get your permission to share my screen. Sure, sir. Give me a moment. Okay. So, as we know, just give me 1 minute, sir. I think. Yeah. So as we know that managing PCOS is, but when we before treating it, we should know actually what is basically PCOS. The full form of PCOS is polycystic ovarian syndrome, when we say, that means it is a combination of multiple symptoms. And when we say PCOD, that means this is a disease which has started with few symptoms, but if it goes and it uh, overcomes, it reaches multiple organs, then it becomes a syndrome. So we here are to bring that concept that this is a hormonal imbalance disease which can be with the holistic means, with the ancient cleansing methods and diet and lifestyle management. We can manage it well. We cannot say that this is not curable, but definitely this is purely curable. How? Let's see further. So, as I mentioned, that this is a polycystic ovarian syndrome. In Ayurveda, this is actually considered nothing but a metabolic disorder that is called Agni Vishmajagna Vikara. That means there is some disturbance in the metabolism which is not able to go properly, absorb the nutrients what we are taking, and that's why the ras dhatu, which is the first dhatu, is not getting converted into proper of its means, and then further into the blood and the muscle, and then further the fat. And in these timings only, the ras, as per the Ayurveda, generates the menstruation in females, which also gets disturbed. We all know that the symptoms of PCOS are more in, not in all, but in 28% amenorrhea, oligomenorrhea are the symptoms. In few females which are in reproductive life, infertility is the issue. Hirsutism is found maximum females, and which makes their confidence also low. Again, the obesity, acne, and few females are asymptomatic until and unless due to any some other reason they are not going for the scan, they don't come to know. So that way, the how they are originating the new generation of the cyst, but this is actually our unovulatory ovums which couldn't shed off the egg. The normal cycle, how it happens, each and every month one of our ovary goes through the maturation of the follicles, which is called the graphican follicles, which further gets mature and releases the egg out of that, and the rest of the part is called the luteus corpum. So now, if due to some hormonal disturbance or more weight, where the circulation is not going to your pelvic system, to the ovaries, due to which your ovaries are not getting the proper hormones which are responsible to produce this ovum, so that the graphene follicle is broken and this ovum is released. If this process is not happening, then this ovum will stay in the ovary for that month. It will not release the egg, and that unovulatory part of that follicle is known as cyst. Now, if the same thing happens in the next month and again in the further months, then these all are on the neck of the ovary. Are, you can all see, it looks like a necklace. They are generated here. And this problem is called PCOS. Now, when these all will be in multiple numbers, hormone secretion further will be deviated. And even if you were not having any issue, the issues will arise from the hormonal imbalance. This is actually the PCOS, and this is really very, very important, because few of the females, when they come to us, they actually think that they got the cancer kind of problem. No, this is absolutely the benign cyst, which are just your unshed ovums, unshed eggs. And if you are taking any medications here, the any hormones here, what happens that due to the hormones withdrawal only, you will get the menstruation, but you will not get your egg released. So I want to bring that awareness that immediately don't go for the hormonal solutions. Try your body, give time to your body with the deep cleansing, with the holistic issue, and not give the body this easy solution of hormones and get into a trap to go for the vicious cycle. Coming further, um, as we are knowing that this is a absolutely a rising issue, and this is day by day it is increasing. This has impacted 18 to 13% of reproductive aged women, and not that but every age, but this is the main age which is getting impacted. And also, this is a issue which doesn't bring only the physical issues, it brings the emotional, mental, all kind of issues in a woman. And if I don't oversay, this is called a thief of the womanhood. So it, because it sometimes takes away the joy, it sometimes gives so much uh, premenstrual symptoms that the person is so much in embarrassment that okay, there can be some emotional issues, there can be some other issues, and even due to acne, hirsutism, the female lose the confidence. So this is a serious issue and we need to definitely cure it. We need to understand the bit reasons around it. One, as I told, that in due to any reason, whether it is your non active lifestyle or whether it is your any of the eating habits, If the circulation is not proper to the ovaries, this issue can happen. Along with these issue, insulin resistance also is a problem, which mostly make this PCOS condition happening. And most of the time overweight is also considered a big issue, because the fat is around that. First, fat will create the insulin resistance. Second, it is not allowing the circulation to go to your pelvic system. So these are the clinical manifestations which we usually see in PCOS. One is that hirsutism, we spoke, insulin resistance. Then sometimes you see the acne, the females are suffering from the depression kind of issues also. And there is high androgen also when we get into the test. What test we can get? We can get the blood test done, which shows the hormonal imbalance. We can check the symptoms of the female. Also, the confirmatory test is actually the TVS scan of one's pelvic system, female's pelvic system, which actually tells that yes, there is some issue in the ovary. There are multiple cysts lying there, which confirms the diagnosis. Quickly coming to the management, because in this session I will more focus on the management part. Ayurveda absolutely says that this is a granthi. This is a, and granthi comes under the sadhya to krich sadhya issues. That means that either you can easily treat it, or with some difficulty you can treat it. It can come back, but again you can treat it. But it is not in asadhya, that means not treatable issues. No, it's not that, because it comes from two doshas, that is pitta and kapha. Until and unless you are able to resolve these doshas, you are able to bring back these doshas in balance, you are good. In this all journey, we start the complete thing from the cleansing, because if you are not cleaning the root cause, you are not taking away the issues what are happening, what are surging there, you will not able to properly bring the results. Every time what will happen, you will always just manage the symptoms, again the disease will come. Again you will go into some other kind of chemical formulations, or you will go for some kind of rigorous weight management techniques, but it will not help you completely if you are not giving the importance to cleaning is as important. Like if in our simple languages we say that if we are just decorating our home, before decorating we need to clean the home, right? Before, without cleaning your home, if you decorate, it won't give a good look. Same way, if you want to bring any permanent change, any major change in your body, first we need to clean. And that cleansing process in Ayurveda is known as shodhana panch karma. Then there are another ways, the herbal formulation, lifestyle modification, diet modifications, and which all together brings balance the doshas vata, pitta, kapha. We will come one by one on that, how your shodhana helps. Basically, as I told, first shodhana is able to, the cleansing process is able to make you rid the body from the built up toxins keep depositing in the body. And the person who has some issues like insulin resistance, PCOS, we have to consider that toxins are more than the normal person, so the deep cleansing is required. And it will also help to stimulate, to bring back the balance in the doshas, while removing the ama. Ama is the undigested food which clogs the channels, and it will not allow either the hormones proper production and the blood circulation. It will obstruct the body channels. Once you are able to remove this ama, obviously the circulation is better for all lymphatic channels, for hormonal channels, for blood circulation channels. Obviously your system will be better. There are 5 ways which help actually to body cleansing easily. One is induced purgations, where you clean your intestines so that whatever the uh, so prolonged toxins or undigested food or some other kind of your these maida kind of things which stick to the intestine, these are not able to come out with your normal daily routine uh, motion. In that time we need to lubricate your complete body, prepare this body and specifically the intestines, and then we have to little bit induce the purgation so that the body is cleaned better and these long staying unwanted things are coming out of the body. Once these are coming out of the body, obviously your metabolism will improve. If already there are fermentation happening, your metabolism will definitely go low and the real absorption, real assimilation will not happen, and the occurrence of the disease will be multiple folded. Same way, their next process is basti, which is mostly done after the virechana, because most of the doshas, pitta dosha and kapha doshas, are removed from virechana. Whatever remaining doshas are, the medication, the formulations of kashai based and oil based medications are giving in form of enema, which not only are absorbed by intestine, but the research says that this is also has the capacity to cross the brain barrier, and it helps to bring the hormonal balance. Same way the Nasim works, it is the direct method, direct way known to reach your Shringatak Marma, which stays here and it spreads out in all your eyes, ears, your complete scalp, under skull, and it helps pituitary gland to bring the hormonal balance, because all the stimulating hormone, the follicle stimulating hormone, luteinizing stimulating hormone, ultimately they are released from the pituitary. Until and unless you don't bring the balance from the pituitary level, the balance in other hormones which are happening on the local part of the reproductive system will not happen. So nasyam is a very potential shodhana way, where we put the oil drops through the nose, and it is considered that it brings out all the toxins from the upper the clavicle region. All the toxins will come out. You can prepare your body with abhyanga, dhara, and dhara also help for the relaxation, because stress is a reason for the PCOS, also for the insulin resistance, also for the obesity, and it is a consequence of the PCOS once the person has. So stress management through abhyanga, through shirodhara, through body dhara is very important in management of PCOS. So overall, one is that Shodhana, Panchkarma, this deep cleansing process helps the doshas to pacify. And when we do it with Langhan Pachna along with, so it will never ever occur again. If you do Langhana Pachna, that means you improve the metabolism without cleansing, it may occur again. And secondly, it has the capacity to manage your disease, not only the PCOS, but another metabolic disorders, other neurological disorders from the root level. So I have explained this, so I will quickly skip these slides. I will directly now come to the food part, which is a major precipitating factor. In all the cases of PCOS we find, and that is the reason this is very much evident in these days adolescents, because from the childhood the kids are mostly on the fast food, on the processed food, and major problem is not only this processed or the fast food, but the way of eating. They don't know that how many times they should eat before digesting the earlier food they eat. Just they go with the friends and they eat again, or otherwise whenever they are trying to lose weight, if they have gained weight, they will absolutely go on fasting, which is again cause the issue. So this irregularities and also the type of foods create definitely imbalances. First is fat, which actually make the insulin resistance, production of androgen, and also triggers the chronic inflammation, which further creates these kind of issues. I have just brought back a bit more focus on that, how bad fats are creating issues. They make the ovaries enlarge in size because the fat consumption, the high trans fat consumption actually creates the hormonal issues, and which creates the this ovary size enlarge and also the cyst formation there. Next culprit is bad sugars. When I say bad sugars, that means the low chain carbohydrates. Okay, so if the simple carbohydrates we take, their digestion happens very fast, very fast. For example, the sugar, if you take, right, what, so as soon as you take, it will be quickly digested, but it utilizes also very fast, it won't stay in your body, and the fall in the sugar comes later quickly, against to the long lasting sugars, which are called the complex carbohydrates. When we take them, the sugar release is constant, prolonged, and for a complete prolonged times, which makes the blood levels of the sugar continuity in continuity. This helps to manage the insulin well. Just we can quickly go through how sugar makes like the insulin resistance when comes in the picture. It makes two problems: one is fat deposit and the testosterone, which ultimately converts into the PCOS. The studies has absolutely, the research has told us that if we are able to manage our carbohydrates in our diet, we reduce the carbohydrates, and whatever carbohydrates we take it in the complex forms, for example the oats, the millets, rather than and even the whole wheat. We don't need to every time shift to all the our grains, but the whole wheat, if we take properly, that also is a complex carbohydrate. Just we should avoid the whites, that means the refined oils, the white atta, the white sugar, right, okay, the white salt. These all things we need to avoid, and major that gives the major difference, and it has proved that it can reduce the hyperinsulinemia. So how the PCOS diet helps? First, as I told, the complex carbohydrate diet, which is known as low glycemic index diet, then the anti-inflammatory diet or the detox diet, which means the high antioxidant diet. Uh, all the fruits, all the vegetables, these are very high in their antioxidant value. So this helps the body to remove the free radicals and to resolve the insulin resistance, to remove the unwanted fat, and also to improve the blood circulation, and obviously it will help for the hormonal balance. And same way the dash diet, we don't need to think here much that, oh, we need to take this fruit or this vegetable. Simple formula is that fill your whole day with 5 vegetables minimum and 5 fruits minimum, and all should be colorful. Every time change the color of your vegetable and fruit, you are sorted. You don't need to think much on that. But yes, if sometimes you are not able to resolve that issue, then definitely go to the expert, seek the help, so that what are your micronutrient deficiencies and your where you are lacking on the macronutrients, and how the balance needs to be created for yourself. And moreover, you need to know the you need the help for continuity of what you are doing. Lifestyle changes, the regular exercise, reduce stress, weight management, definitely make difference in PCOS management. This is proven study that if the person is able to reduce the 5 to 7% of the weight of their body, if they are overweight, it definitely helps them to manage the PCOS better. And that too, please remember, not the water weight or the muscle weight. It should be absolutely the fat loss, majorly from your central body. So these all are the nutritions which are required to manage the PCOS. The vitamin D should be enough. The vitamin B should be sufficient, especially B12, folate. You should have enough fibers in your body, polyphenols, inositols. Inositols absolutely directly help to manage the feminine hormones. Very, very blessed. This hormones what we are able to get from the nature itself. You don't need to get to through the hormones for this. And more you take the plant based nutrition, you will be having the benefit of the proteins which are easily digestible while your metabolism is low. Then obviously it will convert into the right kind of the proteins and not convert into the fats, which obviously help you in the fat management. So this is basically how we deal holistically for a PCOS manage. When we manage the PCOS person, we take the BMI, we take the BMR, we take the BCA, medical history. Then we also take the dosha analysis as per Ayurveda. We understand the complete body composition and body type. Then we do the diet analysis, that what are the macros, micros, calories are going on, and then we make complete our analysis, and then the diet plan. So nutrition plan, I would always say, rather than making your diet plans, please plan your nutrition. How much, what all you need in what quantity, and then divide it into your available slots. But manage your nutrition directly. Don't jump into the diet plan. So this way we create, after creating the nutrition plan, we create the diet plan, and then we do the weekly analysis that how much nutrition was taken by the person. And this all diet in Ayurveda, we prefer making it in the respect of the body type. If the person is pitta, then we have to give the pit shamak diet. If there is the kapha component high, we need to give the kapha shamak diet. Only and only looking at the calories and the nutrition will never ever help. So then we come up with the monthly report, that how the person is improving day by day. I would like to show you one case study where, if you see, even this female was not able to reduce the weight, but still the doshas were managed very well. So if you see, there all the thirst, fatigue, the swelling in the body, the low mood, these sleep, these all were month by month improved. If my screen is properly visible to you all, you can see that it is not the one day journey, but it takes 5 to 6 months to reach you this journey. But yeah, if you are consistent, if you are following properly, and if you are on the concepts. What are the concepts? First, then whatever the help is required from the herbal formulation or from the diet or from the life management, do this all together, and there is no reason that we will not get the results in this. Uh, we have resolved multiple cases, and now I would like you to ask if you have any questions. And before that, I will just say one major thing when we are managing PCOS. The major point what we all need to understand is, we should remember PCOS, rather PCOC. That means, please come out of your comfort zone. So if we stay in our comfort zone, if we say, oh, some medicine, some pills, we will just gulp and we will get the result, it is not going to happen. You have to come out of your comfort zone. You have to put all the effort on 360-degree angle of holistic approach with your complete happy mood and strong will. Then only this is going to resolve. Only consultant, only your expert will not happen. You have to make as a team with your expert and participate properly. So I believe I have completed my part, and I would like to take your all questions. Thank you, Dr. Pitka.
Good evening, ma'am.
Good
Sir, I
evening.
had one question for the doctor that are women above the age of 40 years, can they also be affected by PCOS or the age, we are in a safe limit now?
Sure. So, Shifti, this is a very valuable questions, because most of the time after 40, females think that okay, now we are free of this risk, but no, this is not. This disease is from adolescent to menopause. Yeah, definitely the second and the third decade have the highest chances of having this issue, but no age of the from the your puberty to menopause is skipped from getting this problem. So, and also I would like to say that most of the females, what they think, see, there is bit difference in the approach. The adolescent females, when they know the PCOS they have, their focus is to resolve their cosmetic issues, the hirsutism, the acne, right? Okay, and for that, whatever comes into the solution, they take that easy solutions, but ultimately they also need to meet their fertility part, right? So they need to understand their body, and then accordingly need to take the solutions in a very proper manner, which is resolving the issue for today also, but not creating the issues for tomorrow, rather making it better for tomorrow. Second stage, when it comes to the second and third stage, where the females are in fertility age, there the major focus is infertility. When most of the females come to know they have the PCOS when they are not able to conceive, and their whole focus is for to just get that issue resolved, and they want to just get the conception happen. In that scenario also, they are in very much panic stage and go whatever is solution is available around them, and they never ever judge that it is their body. A female's body is made for reproduction, made for baby production, but it is not the only part of their body. PCOS permanently, that will help them to understand this issue better and resolve it for a long term, not only for that instance. Same way, when the people, as you rightly said, after 40, after 40, if the issue is coming, first of all, most of the female don't realize that they have the issue. They do feel, I have seen people 37, 40 reaching, they are having some issues, and they says, ma'am, now to we are meeting our menopause na kuch hoga hi. But menopause happen almost 50. You cannot expect the changes before 12 years. So we need to understand, we need to bring that awareness that that can be the reason for PCOS, and we need to check, and we definitely can resolve it in the better manner, proper manner, rather than taking it granted ki yes, now to something will happen for the body and let it happen. Yeah.
Sure. Thank you, ma'am. Thank you.
Yeah. Yes, I think this is Rufita.
Yes, ma'am. Ma'am,
Yeah.
I have doubt regarding the fallopian tube blockage.
Mm-hmm.
So, what can we do to prevent or come out of it? Is there any possibilities to come out of that fallopian tube blockages? No.
Yes, definitely. So you are asking me that if already the fallopian tube blockage has happened, right? Then
Yes,
how
ma'am.
to come out of that?
Yes,
Yeah.
ma'am.
Okay, so the first very important thing is that you need to understand that what are the uh, are you able to understand what are the reasons for that? So if the person is already having the PCOS kind of or hormonal imbalance kind of things for fallopian blockage, that needs to be resolved. And the second thing is, there are there are these shodhanas which we called the bastis. okay, which can actually help to go deep into your reproductive system after cleaning your local reproductive system, which goes in and followed by, we call it in Ayurveda, pichu dharan. First we give the enema, and then we give the pichu, which is a oil kept there for a longer time. When it is absorbed by your uterus endometrium layer and reaching to the fallopian tube, it actually helps to keep dissolving that blockage and improves the circulation there. Along with that, there are herbal formulations which will help you. And ultimately, if this all doesn't work, so definitely you should go for some gynec who will help you to remove this blockage. But it is definitely done by all the both the methods, by the ancient cleansing methods also, and from the allopathic medicines also.
Okay, ma'am. Thank you.
Hello. Good evening, Dr. Bedkar sir, Principal sir. Good evening, ma'am. Wonderful presentation today you had. And really, from Ayurvedic point of view, very well explained. I'm a homeopathic doctor basically, and I'm treating number of PCOS cases. And really now they are emerging too much. Too many people are coming with this, and especially the younger, people are coming to us. And you have placed it from your point of view, but what I feel, why we are getting such a kind of a patients, the reason behind it, what I feel is the stress what people are taking, the girls are taking, and that competitive drive, and which where the menses become obstacle for them. Right, and over there you find these girls develops this PCOS, and when they enter into that marriage bracket, the next question comes about the fertility question is there. Infertility comes then. So usually, and it may be associated with some DM and other conditions, diabetes and other conditions. So it becomes very difficult and challenging for doctors also. I've seen, the girls are not getting their menses for 7 months, 8 months. And usually the traditional medicine, conventional medicines are, 21 days, those contraceptive pills they are giving. And then, they induces the menses. And of course, everyone knows that is a withdrawal bleeding. That is not a natural menses for her.
Absolutely.
And they go for 3 cycles, and then still the things remains the same thing, some at same place. And then they start playing with it, So many patients comes from other hand to us, and we have to treat it. Yes, definitely in homeopathy also we are treating PCOS and PCOD conditions, and especially connected with some hormonal. And there is a kind of relation what very well you place, that obesity and PCOS, that goes hand in hand. But many patients comes, they are very lean, thin, still they are having PCOS changes. And when we send them for USG, you can find out how much amount of, the problem is there and this and that. So bulky, ovarian condition. So this is very common nowadays. So I think, we have to change our lifestyle somewhere. What you have correctly said, we have to regularize it. We should be disciplined. Nowadays, we are not, we are not following the discipline of our life, our health. Everywhere we are, lagging behind. And that is also one of the reasons. If we are telling them, I usually ask them to do 12 Surya Namaskara, very simple. And it really helps. It really helps.
Agree.
Yeah. And but people are reluctant, what doctor is saying, something just advice for the sake of advice doctor is telling us, we cannot go to their home every time. Now and then we have to motivate them, definitely. So these are the things very correctly you have said. But I want to ask one question, that there are some techniques in Ayurveda, like you are doing some kind of vaginal wash or vaginal, something. So whether it really helps, that is one.
It absolutely helps. I can show you enormous scans report before and after, okay. Not even the PCOS we are able to actually resolve the adenomyosis cases, the fibroid cases, because see, we need to understand that when there is less absorption of the medicine, when the hormones are not reaching to the right place, so obviously that same thing will happen with the medicine also, what we are giving orally, whether it is a supplement or it is a herbal formulation, or even it is your part of diet, right? Okay, so in those cases it is very very important to make reach the medicine through the nearest way. So for the pelvic system, your reproductive parts of, or all the parts, definitely the vagina is the best route to make that medicine to reach there. Okay, so but we have to first cleanse, which is we call the douches, and after that, as I explained, we give the enemas, and followed by the pichu dharan, which is a long sustainable way to keep releasing. If you see in the modern also, we give the suppositories, right? This is same way. Okay, so before any surgeries we give the enemas, right? Okay, it is only the mode of the medication, and also the way of doing it, and how many days you are continuously doing it makes the difference. And you can reach us out for further on our web, through our website also, and we can really take you through the cases which we have proudly resolved, and we have helped the people not only for resolving the fertility issues, but there are another issues also which are due to the hormonal imbalance.
Yeah, thank you, ma'am. It is a wonderful, we are having a gift of Ayurveda with us, and we should motivate and utilize this kind of, techniques, because it is ancient methods what we are still following, and it is really working very well. Yes, definitely. I have also done one of the research work with a sample size of 50 patients. And then at one place we had just gone with homeopathic medicine, and other place we have told them to regularize their lifestyle and with the Surya Namaskara. And definitely there was an impact of Surya Namaskara on their health. They reduced weight tremendously, and vice versa. Their PCOS problem also got reduced. Only the question left behind is why thin people are getting PCOS. That is the biggest question. And I think you, in your presentation, you talked about Agni and metabolism and other aspects. So wonderfully explained. We have to connect it, definitely. And all sciences, they really helps our patient. And we have to take them together, integrated approach. What
Absolutely.
Ayurveda is, should go with Ayurveda, what homeopathic, and there should be, I think that facilitates. So integrated centers has to be established so we can learn from each other also. Thank you very much, ma'am, for your wonderful presentation. Dr. Bedkar, sir, thank you very much for your, providing such a wonderful resource persons. Thank you.
Thanks for the wonderful discussion, doctor. It was great. But it was wonderful discussion. Awesome. Thank you, doctor, for such a wonderful platform actually. So wish you all the best, and you can reach Dr. Bedkar, you can reach out to us for more information and for more queries. Thanks. Namaste.